So my name is Jason Putz. I'm a physical therapist at Physical Therapy Solutions in Manchester, Iowa and Dyersville, Iowa. Today we're going to talk a little bit about kind of the pre-rehabilitation that we would do prior to having a total hip replacement or having a total knee replacement. One of the biggest things that we really want to advocate for our patients is trying to restore or regain as much range of motion prior to surgery as we can. That's important for both the prehab and the rehab afterwards. So from the point of the knee, if you're having a hard time straightening the knee, then we're working on trying to get that knee straight. If we're having a hard time bending the knee, we're going to work on really trying to get that knee to bend. The hip, same concept. If we're really not being able to swing the hip very well, we're really either stretching out the hamstrings or we're stretching out the hip flexors to try to get some of that motion to come back. And then obviously most people are having a hard time or a difficult time with walking because of pain in the knee or the hip. So we're emphasizing trying to get into the pool and do some exercise and walking in the pool where we unload the joint and still get some of that aerobic activity and get those muscles to have to kind of fight against the water without actually causing compression onto the joint. So those are some big things that we'll do. Within the clinic, we kind of look at that loss of range of motion in one direction and prescribe specific exercises to that person, and that's really kind of specific to each person because everybody's got a little bit different mechanical problem before they have their surgery. So that's kind of more of a prescribed by your therapist aspect of the stretching and the strengthening side of things. Big thing is trying to be active as you can without irritating the hip and the knee. I think that's the most important thing, and the pool therapy tends to do a pretty good job with that, trying to get you prepared to go into surgery. If you have any further questions about having a total knee or a total hip replacement, feel free to contact us at Physical Therapy Solutions in Dyersville at 563-875-8615. In Manchester, you can contact us at 563-927-1499. You can always reach us on the web at www.ptsiowa.com, and you can always like us on Facebook and ask us any questions there. Thank you.